You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, new treatment options for people that are suffering with erectile dysfunction. New treatment that is sweeping the country, getting amazing results with the men that are using it. With us, we have to talk about it. He's using it here in San Diego. He's San Diego's board-certified plastic surgeon, Dr. Paul Chasan. Dr. Chasan, welcome back to the program.
Oh, thanks. Thank you very much.
Always a pleasure, and you look younger every time I see you.
Botox and a little cardio.
And I know you eat well, and you try to walk your talk.
I try to walk the walk.
So for people that don't know your practice, and before we get into today's topic, I mean, who's your typical patient these days that you're seeing?
Well, I'm all over the map. As you know, I'm a board-certified plastic surgeon. I have my practice in Del Mar, California, at a freestanding facility. We have 2 operating rooms. So, I mean, we go from 20-year-old women who want breast augmentation all the way up to an 80-year-old who wants a facelift. We do men for liposuction, facelifts, noses. There's really no demographic for what we do. I think as a general, people want to feel good about themselves. They want to look good, and we provide that service.
What's your most popular procedure today?
I think it's always breast, noses, and facelifts.
Facelift. I mean, you're the natural facelift king. Right before we started taping, we were talking in the studio. Look, my editors have edited thousands of these with doctors, and they say Dr. Paul Chasan has the best before and afters, the best facelift out there.
It's a personal journey, and I've worked at every level to try to make that technically the best that it can be. And I do certain things that are more aggressive maybe than other surgeons, but it's an art form, and I think I've developed my skill set over many years.
Now you deal with men and women.
Yes.
Are more and more men coming in now for procedures?
Believe it or not, men have always come in.
Is that right?
And it seems like it's always a news story. More men are coming in, but men have always come in. And you know what, I guess it's more common and more accepted, but for a long time, men benefit. In fact, men benefit from what I do more than women. Men typically have thicker skin. They allow themselves to go farther without doing stuff. Women, they take care of their skin, they use sunblock, they do fillers and Botox until that time. So men don't do anything, all of a sudden they show up and they're like, wow, I can really fix you.
Okay, good. So how did you get involved with erectile dysfunction treatment?
Well,
the guys that are coming into your practice?
Kind of an accident, actually. One of my friends who was very vocal about his erectile dysfunction cornered me one day, and he says, Cialis ain't working for me anymore. And it just so happened he was told the whole poker room about his erectile dysfunction, which is great. He's a very secure guy. He's very handsome guy. He's very successful. And, it's a big deal for him. And so, they were all saying, oh, you need penile implants, or you should use those shots. I said, wait, before you do anything, just go and do this non-invasive thing called extracorporeal shockwave therapy. Just try it and see if it works for you.
It's ultrasound, is that right?
It's ultrasound.
Okay.
It's just an ultrasound machine that's pretty aggressive. And he tried it. And guess what? It changed his life. He said for the first time he was with his girlfriend in the pool, and you know what? No Viagra, no Cialis, and he got an erection, and they had sex, and he said, you know what? Life changing. And that's when a green light went off in my head. I have an awesome facility. I have the nurses who could do it. It seemed like a no-brainer, and I could help a lot of men. And it just was a green light for me. So I learned everything I could about it and found the best machine and trained my staff. And now that's what we do. And it's such a great procedure technique. It's not, it's really not invasive. It doesn't hurt. It takes 10 minutes a session. And to have that kind of a life-changing type, thing to happen to someone, I think it's great. It works. Every guy that we've done it has had some benefit.
On the phone, I asked you on our pre-production meeting, I said, is there any science behind it? Are there any published articles? I mean, you sent me PowerPoints, and we were going to print them. It was 180 or 160 or 180,
huge amount of science. Lots of material. So it actually started in the physical therapy world to try to get tendons to heal and plantar fasciitis, and it has lots of other uses outside of erectile dysfunction. And basically what you're doing is you're tricking your body into creating an injury that's substantial enough for your body to create all the mediators of inflammation. And what happens when you have inflammation? brings blood supply to those areas. So, but without causing a true injury. So it's kind of that zone where it's tricking your body into thinking it was injured, supplying all those mediators to cause vasodilation, which is key in the penis.
So we're talking about, it's a blood flow problem?
Yes, it is.
Is that right?
Uh-huh.
Okay, so this basically increases the blood flow.
That's correct.
This ultrasound,
yes.
shock wave, you call it?
Yes, yeah. So it's a 10-minute procedure. It's a little uncomfortable. They put on numbing, and after that, it's not even an issue. And it's something they do twice a week for 3 weeks. Usually we recommend 6 sessions. Most people start to feel something at 2 to 3 sessions, but we like to 6 sessions for the mild to moderate erectile dysfunction patient.
Now, men that come to you for liposuction, or they come to you for their man boobs, or they come to you for a facelift, do they confide in you? Do they ask you questions about this?
You know, it's
And
one of
has
those
this been
things that
going on
people
for a while?
really don't talk about. They're just starting to, because now this treatment is available. This treatment has only been available for a few years, so it's relatively new. And people, it's one of those things, no one wants to brag about the erectile dysfunction.
I was telling you before we came on, I said, look, I've never had one person in my life, not one of my male friends, has ever said I have ED.
Yeah,
That's like not something you talk about.
and even if they do, they won't admit it. But now that there's up until now, it's really easy, just take Viagra or Cialis or something like that. The problem is after you've taken those for 5, 6, 10 years, and they used to work, and you're getting older, and the ED's getting a little worse, they don't work anymore. Now,
Interesting.
That's the problem, is what do you do when that stuff stops working? Because it doesn't work forever. And as long as you take it, it works less and less and less.
So I was reading the stuff that you sent me. So I guess half of all men over 50, 5 out of 10 guys have a erectile dysfunction.
Absolutely, and that's the issue, Randy. You walk into a room of 50-year-olds, okay? How many guys are gonna raise their hand and say, hey, I have erectile dysfunction? But you know that half of them do. And so,
Is that right?
And even a lot of patients come in younger, and they have erectile dysfunction. We have 30s and 40-year-olds, and then we have people who just want to have better performance. Honestly, this works on performance. It makes their erections harder, longer, and so some guys are coming in just for performance.
So there's 2 categories: the people that have erection problems,
Yes,
and then the people that actually just want even more.
that's correct.
Like they have no erection problems, but they want even better.
That's right. That's
Interesting.
right. Yeah.
So since there's a blood flow problem, right?
Yes.
So this addresses that. You increase the blood flow.
Yes.
It lasts for like 3 months?
3 to 6 months. Yeah, that's the typical. And so after the initial treatment, then we recommend 1 or 2 every 6 months just to keep it going.
And this is something that is like a prevention measure.
It can be, absolutely.
Like for some people. Is that one way to look at it?
I would say that no different than, say, Botox and wrinkles. I mean, there's a point where you have enough wrinkles where you want to do Botox and it works, or you want to prevent wrinkles, and it's all really an individual, very personal thing.
Now, are there people, so what levels of ED or erectile dysfunction does this treat?
So we have something called a SHIM score, and it basically is 5 questions that really tells you whether you're mild, moderate, or severe. So for the milds, this is perfect for the mild ED patient.
Okay.
And
what is mild? Like, give us a working definition.
it takes longer to get an erection. Sometimes it's harder to get an erection. It takes over 5 minutes to get an erection, that kind of stuff.
Okay.
For the mild, the extracorporeal shockwave therapy really works, and all our patients have had benefits. Then you have moderate, which is they need Cialis or Viagra. They don't always get an erection. And so for the moderates, it helps a lot. Sometimes for the moderates, we recommend more like 12 sessions versus 6 sessions. And then you have severe, where they just cannot have an erection. And with those people, we have 12 sessions plus what we call the P-shot. The P-shot is stem cells. So not only have you used the shockwave therapy to dilate their blood vessels, now you're putting in stem cells. And the stem cells are like turbocharging the mediators that cause vessel dilation, and basically rejuvenating the lining of those blood vessels to the penis.
Okay, so in a way, I mean, you're making your penis younger.
That's a good way to look at it. Yeah, I never thought about that, but absolutely, that's exactly what we're trying to do.
is by just returning the blood flow to the way it used to be.
Yes.
Because that's why we exercise too, right? We exercise because it helps our heart, exercise to help the blood flow throughout our body.
Right, but the thing that's different is when you exercise and your peripheral capillaries dilate, you're feeding the skin, but you're not feeding your penis because that blood flow isn't dilating when everything else is.
So if somebody has ED, mild ED, they have ED, they've heard, maybe done some research about this, they call your office, what do they say? Because it's probably embarrassing.
You know, it's interesting that you say that. When I first started doing this, I thought that that would be an issue, that they would be embarrassed to call. And, you know, we've gone out of our way to make our office very professional. People really aren't that embarrassed about it. Hey, they call.
Is that right? Okay,
yeah,
good.
they're pretty open about it. You know, I got ED, big deal. And they come in, they get their treatment, and they walk out. And all my nurses are pretty cute too, so it never hurts. But yeah, you know what? I haven't really seen anyone being shy or, you know, lack of eye contact. A lot of these guys come in, they're young, studly guys, and they come in, yeah, I'd love some help. Boom, they get it done.
But
and
some guys come in for that edge. They just want to take it to the next level.
Absolutely, they do. And we do have performance people too. But I would say that most guys are mature and they come in and they get it treated. And I thought it was going to be an issue and it'd be an uncomfortable issue. But I just took a call today. The guy's like, hey, I went here, I went there. I kind of liked your office. Tell me about it. And that was it. And I told him kind of what I'm talking to you about. And there was no weirdness about it.
You're excited about this. I mean, you like this.
I think I'm changing lives.
Because you're not a gimmicky guy. You know, it's like you call me every couple of years with something that's really hot, trending, and this is one of those things, I guess.
I get hit on
by everybody,
every week. You know, a new product, a new serum, a new device, a new this. I only go with winners, and this is a winner.
Is that right? Okay.
Yeah.
So take me through the process. A man goes in. What's the consultation like? And how soon can they start?
All right, so they can start that very day. They meet with they don't meet with me because it's a non-invasive treatment that my nurse does, and my nurses are very well versed in it. So they come in, they meet with one of my two nurses. It's a consultation, it's about a 15-minute consultation just to make sure they're healthy and there's no other issues. They can do their first treatment that day. Okay. We place topical numbing on them. We allow that to numb for 20 minutes or so, and then they can do the treatment. And what we do is we send them home with the topical numbing, and so they can numb up before they come to the office. And our general program is 2 treatments a week for 3 weeks.
How soon do they start feeling results? We're seeing results.
Within 2 or 3 treatments, they're seeing results.
Is that right?
Yeah, they say the things I hear about in the middle of the night. I'm starting to have an erection. I woke up with an erection. I haven't woke up with an erection in years, and they're telling us that after just 2 or 3 treatments.
Okay, for people just tuning in, we're talking about erectile dysfunction. There's a new treatment option that is kind of sweeping the country right now, and with us we have board-certified plastic surgeon, Dr. Paul Chasan, and it's Gainswave, and it's shockwave therapy, ultrasound.
Correct. Ultrasound.
That's hitting the area. Mm-hmm. Like, is it puffing it up? Is it
no, it doesn't. It doesn't puff. It creates a very mild injury and tricks the blood vessels of the penis into thinking they've been injured and releasing all these cytokines and chemical mediators that stimulate, quote, blood flow.
Okay.
And that's really what it's doing.
Because it is a blood flow problem.
It's a blood flow problem. It's simple, and it seems so simple, but it really works.
It's like Botox, right? Botox works. Liposuction works. And this works.
This works.
So what about your whole circle of friends? The rest of the poker players, are they all denying that they have problems?
No, they come in.
Is that right?
Oh yeah. Several of them come in regularly. Okay. And they've all had benefits.
They all like it.
Yeah.
You know, and let's talk for a moment, because we were in the green room talking about when a man has ED, it really affects him psychologically. Huge. And affects his life. Huge. Elaborate on that.
Well, just recently I had actually a wife inquiring for her husband, and he has severe erectile dysfunction. And, you know, she says his biggest dream is just to please me. And,
nice.
You know, she was going to buy it for him. But you know what? That's it. I mean, the fact is sometimes, you know, as you get older and things start slowing down, and it's one of those things that happens so insidiously. It happens over years, and you don't really think about doing it. And then one day you realize you really have an issue. And why wouldn't you? This is so essential to relationships. Why wouldn't you want to have a more intimate relationship, have more confidence. That's what and that's where I get excited, because when somebody tells me these stories like I just told you, it's awesome. And like I said, the life-changing aspect of it's terrific.
If 5 out of 10 guys are having erection problems, that's got to be tough dating. It's almost like they have a dirty little secret.
Yeah.
Like the relationship's starting to get pretty serious and they're going, oh boy,
yeah,
I got a problem.
And some...
Because you meet with a lot of these guys on plastic surgery consults.
Get by with Viagra and Cialis. Some can't. They may not have their Viagra and Cialis with them that time. Wouldn't it be great if it was just natural? And then if you needed to augment, sure, you can augment it with those. But sometimes if you've been doing those for a long time, things don't work as well.
And this is natural. I mean, this is like one of those
there's no drugs involved.
For people that don't want to take a drug or something like that.
Yeah.
Do you think it's like a biohack, like a cheating Mother Nature?
It is. It's tricking the body, as it were. And also, some people just don't handle the Viagra and Cialis very well. They get headaches, and it can be really bad for people. Heart disease, for all those other things. There's an alternative.
So how old can you be to get this?
All the way up into your 80s.
I mean, is it like anything else? The earlier treatment, the better?
For different people.
Okay.
So I think that you're asking, can it be preventative? I think so. Then it would be performance related. I think there's also the sweet spot for us is the mild ED, the 50-year-old who's just like, they're getting busy and it's, hey, I gotta get in the mood kind of thing, as opposed to just, it naturally happening. And there's a lot of psychology as part of it, but the fact is if you know that you'll be able to get an erection when the time hits, how confident does that make you feel?
Yeah, it's good. It's good. Now, I had, you offer Coolsculpting where you are.
Yes.
And I had Coolsculpting at your place.
Right.
Love it. My abs almost have 0 fat on them, thanks to you. But I heard a quote. I said, who should get Coolsculpting? And a guy on my show said, if you're a man over 40, you have at least an inch of fat on you that you hate. So everybody over 40 should get it. Is that like this? That
So
if you're over 40
and you have a penis more than 1 inch, you should do it.
Should do it. Okay.
No, yes, I think that if you have any erectile dysfunction or any lack of confidence in the bedroom,
as you get older, you're getting blood flow issues.
Absolutely.
Right? Just less circulation.
And certain lifestyle things. If you're sedentary, you're not getting blood flow. If you drink a lot of alcohol, if you smoke, those are all things that shut down blood flow and would benefit from doing this. And just natural age.
So you do this like every 3 months?
You do it 2 weeks. You do 3 weeks, twice a week for 3 weeks. And then every 6 months you do 2 or 3.
So they could be in and out in 15 minutes?
Yes.
At your office?
That's right.
And pain, it's a little painful? Slightly?
Without the numbing, it would be a little discomforting. With the numbing, they can't feel it.
So is it heat? Because ultrasound
No, it's not heat.
Not heat?
It's more physical. It's more of a physical beatdown.
Is that right?
Yeah.
I saw the video of it, by the way. I didn't see the physical beatdown part of it.
Oh,
And the person didn't look like they were in pain either.
No, they're not in pain. You know what it's similar to? It's a different version, a much more high-tech version. Do you know those massagers they sell on on the golf channels? That little plunger that goes boom, 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 boom,
Yeah,
boom,
but it doesn't appear to be doing that.
It's
But
doing
it is doing that?
It's doing that at a much higher frequency with a much shorter.
Oh, so it's a frequency, not like a
Yeah, it's a machine
it.
that's hitting you, but at a high frequency.
Is that right?
Yeah.
Okay, we're gonna take a quick break, and we come back more about what people can expect and some more patient testimonials. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
Is a little trouble in the bedroom making you feel less of a man? That lack of self-confidence can impact a lot more than your love life. As you get older, your sexual performance decreases because the blood vessels that supply blood to your penis begin to collapse or break down. The Gainswave is a remarkable, non-invasive, drug-free treatment that restores blood flow to the penis by stimulating the growth of new blood vessels. By applying focused pulses of energy to erectile tissue, it then triggers a response that wakes up dormant stem cells and growth factors in the penis. These growth factors stimulate the creation of new blood vessels, remove vascular plaque, and rejuvenates erectile tissue. Men's Health magazine recently called this revolutionary treatment the new Viagra. The Urology Times published a study saying, treatment success seen even in men who would not respond to the most common oral ED medications. And even the prestigious National Institutes of Health found that the treatment works on men who've previously failed to respond to PDE5 inhibitors like Viagra and Cialis.
I didn't have a problem getting an erection, but they weren't as strong and they weren't as intense as they are now. Oh, after the gains wave, I noticed a firmer and fuller penis, and the erections were much harder and much stronger.
I've seen a larger penis, I see more blood, I see more stronger erections, I see more sensitivity.
Is drug and surgery free, is completely non-invasive, and has little or no known side effects. Is a simple in-office procedure with each treatment taking only 20 to 30 minutes. Provides long-lasting results with little or no downtime. Don't sit there and think you have to accept a less than satisfactory love life. Wave goodbye to trouble in the bedroom with GainsWave.
You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Big topic today, erectile dysfunction. There's a new treatment option that works, and it's shock wave therapy. With us, we have board-certified plastic surgeon, Dr. Paul Chasan. Okay, so this works.
It does.
You have personal friends that use, a circle of friends that are doing this.
Friends and patients, and everybody has gotten a result.
So mild to moderate erectile dysfunction, it works for.
It's the perfect sweet spot.
If somebody has pretty bad erectile, I mean, they could still use Viagra or Cialis, but it's starting not to work.
Even severe, 12 treatments plus stem cell shots make a big difference. And for someone who can't even have an erection, to be able to have an erection, how life-changing is that?
Okay, so this is in a way, because look, we're talking about, just like you do with skin, with the IPLs and things like that, to keep it fresh and young. I mean, this is a way to keep your penis younger.
Yes.
To keep the blood flow there.
Correct.
I mean, because that's what this is all about, right?
Right.
Because I guess Cialis and Viagra, they don't treat the underlying cause. This does.
That's correct.
Is that right?
That's right. Uh-huh. They increase blood supply there, but the problem is that over time, they work less.
And this, so this, you know, according to the research, this also helps with more intense orgasms.
Well, Randy, put it this way. If you're feeling studlier about yourself, if you're more confident in the bedroom, of course it's going to make the whole experience better. And that would lead, in my mind, to more intense orgasms. I think that if you're more confident in the bedroom, I think it's the whole experience is improved.
Have you picked up on any personality changes? That means people that have been treated, or your nurses, people that have been treated and they're back, that they feel a little better, they walk in with a little bit of a skip in their step?
I think so, yeah. I mean, when people tell me the stories of how, they tell me little stories, you know, and how they noticed that it worked. And you can just tell that they're starting to see that confidence.
So like this is a tune-up in a way.
Totally.
Especially for people that are in pretty good shape.
Mm-hmm.
Go in, get it done. Do you think everybody over 40, over 50? I've asked you that before, but maybe you're not allowed to say that. I don't know.
I think everybody could benefit from it. Really, I really do. I think every man could benefit from it. So, you know, the barrier to entry isn't so bad. It's not that expensive. It's not that big of a time out of your day. But it's one of those things where, as I mentioned, it's kind of an insidious onset, and then you just get comfortable with your lack of performance, right? You just get, it's kind of like that little mole that you always want to get removed, but you never do because
it's like the new normal, as they say.
Yeah,
your
exactly.
Erectile
And
dysfunction.
then I feel like do something about it. So easy. You come in, you get it done. You know, 3 weeks of your life, twice a week for 15 minutes. Everybody has that. And if you care about how you perform, if you have some mild erectile dysfunction, this is really a great thing.
Is that right? Okay, look, final message. Somebody watching this, a man, and for whatever reason, he's heard what you have to say, but he's still skeptical.
Yes.
Right?
Right.
Or maybe even too embarrassed to pick up the phone and call.
All you have to do is look online and you see the results. I mean, today, in today's world, you can just type in, does shockwave therapy work for erectile dysfunction? Boom. I guarantee you, you're going to see the overwhelming majority are going to be thumbs up.
You know, I was speaking, knowing you were coming on the show, a urologist, and he was all over this. Loves the idea.
Yes.
I mean, in fact, he's been using it.
Right.
Says it's great. He says he uses it for himself. He claims it's for performance, as you put it.
Yeah.
That means everything's going good, but you just want even better.
And I can tell you just from our patient, you know, like you had mentioned, I get hit up for new devices literally weekly. And I only like to pick the ones that are winners. And this is a winner. And every patient that we've treated that's completed their 6 treatments has noticed a significant change in their performance.
Now, before I let you go, I wanted to ask you, I always like to ask you, like, what's the new hottest trend or what's new in plastic surgery?
I think that one of the newest and hottest trends is coolsculpting. And coolsculpting, a lot of people have heard about it, and it's really freezing your fat cells. And it's a device that basically attaches to your skin with a suction and freezes an area of fat about maybe this big or bigger, like that. And within 35 minutes, that area, a lot of the fat dies.
Okay.
And so what we found is that 5 years ago, the technology was good. Then 3 years ago, they changed the dynamics of the engineering of how that applies to your skin, and it's even better. And then most recently, my CoolSculpt technicians went to a master's class, and now our results are really amazing.
Much better.
Much better, almost to the point of looking like a liposuction result.
Is that right?
Yeah. And
so CoolSculpting works.
It works. It's machine dependent, but it's also technician dependent. And so I think there's a lot of CoolSculpt machines out there, and they really don't know what they're doing. I mean, we CoolSculpt every day, 2, 3 a day, and we have 2 machines. So we love CoolSculpt. We're seeing unbelievable results with that.
What else is new?
Well, I think facelifting. Okay, facelifting, a lot of people do facelifts. Facelifts have been around, everybody knows what a facelift is. But to do them artfully, to make significant changes, I think facelifting is a personal journey. And I developed a skill set over many years.
What do you mean personal journey? From a surgeon standpoint, personal journey?
You don't just wake up one day and you're a great facelift surgeon. You're not taught how to be a facelift surgeon by one guy and then you go off and do facelifts. It's a personal journey looking at skin types and how their underneath tissues are, not relying on the skin to do the pull, which always looks unnatural. How to create the most natural looking facelift by removing some of the structures underneath the neck. And we were talking about this before. One of the things that I've learned to do is remove submandibular glands, and there's muscles right here, these digastrics. I was looking at, I think I do a world-class facelift. Okay. But that's on the heels of really looking at where my failures are, if I have a recurrence of neck bands, or if somebody's not happy, and you look at it 8 months, a year later. And when you start doing facelifts and you're doing 2 and 3 a week, pretty soon you look at that and you carefully look and try to fix all those little things. And I've developed techniques and a skill set over many years that I think my facelifts I would compare with anyone.
You're that much better this year than you were even just 2 years ago as a facelift guy?
Yeah, I think I keep improving. I do. I'm very passionate about it.
Your photos look good.
I'm still very passionate about it.
Okay, good. We're out of time. I want to thank you so much. Okay, so we talked about erectile dysfunction on the show.
Yeah.
If you have that, or if you just want to do it for prevention, go in, get the shockwave therapy as part
or performance.
And performance. And of course, if you don't like the way you're aging, you can do something about that too.
Absolutely.
All right, Dr. Chasan, always a pleasure. Thanks
okay.
again.
Sure.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.